Hi there friends, this is Dr. David Russ from Portland, Oregon. Welcome to this video where I'm going to update you on my practice and my life, but more importantly, I'm going to address a question that I received from a viewer via email a couple of weeks ago. And this question really stuck with me, and it's something that I thought it would be really useful to just address in depth video style. So that Timothy can get the answer, and so can everyone else. This is something that I've been trying to sort of figure out how to communicate for a really long time. And so I appreciate Timothy's email because it helped me distill my thoughts. And so the question really is about how do I do what I do, and what exactly is going on with my patient treatments that you see on the videos. Now, first, I just want to welcome you, everyone, to this video. I am Dr. Russ. If you don't know me, I'm a chiropractor. I do mostly myofascial work, although I do plenty of adjusting as well. I'm in Portland, Oregon, where it is wintry and gloomy. Tomorrow's Thanksgiving. It's a lovely time of year. It's dark and rainy, which I like the contrast to the hot, bright summers that we have. And if you're a returning viewer, of course, it's lovely to see you. For everyone, I appreciate your time and attention. I appreciate your views. Of course, your likes, subscribes, and shares. All that helps me. I'm always interested in hearing about your thoughts and your experiences, either in the comments section, or you can contact me directly, as Timothy did. I will put a QR code in case you're watching on your computer and you have your phone handy. And I'll also put the link to my contact form in this video description, and I believe in every video on my channel. And I also want to say thanks to everyone who has watched my recent videos that have been sponsored. This is something new for me. I appreciate it. I'm giving it a try. So far, so good. I get a lot of requests for collaboration, which is people wanting to pay me to promote their product. And I say no to most of them. I think it's okay to do some. I want it to be relevant to our work. It's always definitely got to be authentic and honest. And I hope that that is not too intrusive on your experience of my work and your experience of my channel. Also, finally, want to plug channel memberships. This is another thing that helps me. For $3 a month, you can be a channel member. There's some exclusive videos in the membership section. You get other perks as well. I do appreciate it. It does help me keep doing what I'm doing. But to be honest, I'm going to keep doing it whether you join my channel or not, because I like it. It's fun. It's interesting, and it's gratifying for me. So just on the personal side, I'm feeling pretty good. I'm still loving my new office. I've been there since Memorial Day, and in the morning when I go in, I'm just really excited to be there. It's a cool space. I know some of you have been there, and that's so wonderful that you come to see me after watching my channel. And I've also done a little tour of the office, and of course, you've seen plenty of videos of me in different places in my office. Some of my more recent videos have been about exercise, neck, shoulder, ribs, breathing, pelvic floor, lumbar spine, rotational stability, and a series of 3 talkie videos that were specifically focused on the herniated disc and the evolution and history and progression through the healing stages, which if you know anyone or you are dealing with herniated disc, acute or chronic, I hope that you'll share that with them and that they find it useful. Okay, let's get into this email. This email is from Timothy, and I think I'm gonna read it in full. I might skip over little parts here or there, but this is 2 weeks ago. Timothy says, "Hey, Dr. Russ, this is Timothy. I graduated from massage school a couple of months ago and began working at a spa-adjacent business right after. I took to massage quickly." Very cool, Timothy. Congratulations on finishing school and getting a job. And it's really obvious that you care very much about what you're doing and your clients and yourself, and you want to have a good career. And I want that for you. My classmates always asked how I was so good at it already. You got the talent. You got the touch. That's cool. So I get out of school, and when I work, I'm doing mostly putting lotion on my hands and trying to elbow someone's erectors until they're not rock hard anymore, I found quickly this doesn't work. I was standing most of the time and giving knuckles and elbows when I thought the client could take it. But over the past month, after seeing that's me, and Doug Nelson's videos, Doug Nelson of Precision Neuromuscular Therapy, great channel, I'm learning that there is a simpler way to work that won't beat up my body. I'm learning that maybe I won't have to train like an arm wrestling champion, but instead study my anatomy and such, something I never did in school. I'm really glad you're getting this so quickly, just a few months out, and you're already like, there has to be a better way. And there is. And that you're asking the right question, and you're on the path to not burning out. You're on the path to not hurting yourself. Where am I? I need to know what it is that makes what you do different from the average therapist. And here's the question. What am I doing? What is the secret? How do you help people without straining your hands, standing the entire time, and doing it in less than 40 minutes? In school, they didn't harp on clinical reasoning or loosening fascial restrictions. And I think you really put your finger on it right there, Timothy. They made sure our body mechanics were good, but no one ever made a big deal out of doing most of your work from a chair. They didn't teach us about efficiency through addressing origin and insertion. They taught us how to use our elbows and knuckles to save our hands. Okay, so there's gaps in the training, and that's just what it is. They taught you not to hurt yourself. I'm sure they taught you draping, and you had to do your anatomy and physiology, medical terminology. There's a lot to learn. There's a lot to cover. And I think I should say, I went to massage school in 93, and I went to chiropractic school from 94 to 98. And so much of what I do was not taught to me in school. It really is it's your experience working on people, plus your intention to be good at it and wanting to learn, your desire to learn. That's what's necessary. And then the next thing is time. I was thinking about this this morning as I was thinking about this video. I have received so many gifts and support in my life, in my career, the gift of mentorship. I had good mentors. I had some bad mentors too. And a bad mentor will set you back mentally. I had some folks putting thoughts into my head, and I really trusted them. They were authorities in my mind. And they were just doing their best. I don't blame them. They were telling me what they thought was true, but it just didn't work for me. But I tried it on, So it took me, as I was thinking about it this morning, I would say 3 years in practice before I really felt like I knew what the hell I was doing. And what I was doing three years in, which is now almost 25 years ago, is so much different than what I'm doing now. It took me another 7 years, so probably 10 years in practice to develop the set of techniques that I'm still using today. So it was 10 years, which is a really long time to do something. And I would not say that I felt lost. I would not say that I felt ineffective. I mean, certainly you have your days or sometimes even weeks or months where you're like, I just don't feel like I'm very good at this. And so that's where the gift of time comes in. And, it's sort of a truism to say time is your greatest gift, the thing to be most grateful for. And it's true. The fact that I have had 28 years of health enough to do this, and the ability to do this for this long has been an incredible privilege and a great gift. And I credit that really with my ability to develop a technique that works for me, that works for my body, that makes sense to me intellectually, that I feel really good about presenting and offering to people. And I feel it sells itself. I don't need to sell care to people. And that's what you're looking for, Timothy, is I think you're looking for something that works for you, works for your clients, that you feel good about and that you can do for the long term. And it might look a lot like what I do, and it might look really different. And all right, we'll talk more about that. A little bit of a tangent. Here we go. Toward the end of school, most of my class came to the consensus that neuromuscular work was stupid because they didn't understand it. Yikes. I hadn't come to that conclusion, good, but I was frustrated that there was no clear explanation of what it was. That's unfortunate. I used to teach in massage school a long time ago, anatomy and physiology. I never taught technique. And I could really see how neuromuscular therapy might be passed over, given a very brief sort of sketch of what it is. And it looks so simple. And I think that's a little bit about what's in your email, Timothy, is like, it doesn't look like I'm doing anything. But really, I am. And I don't know, spoiler alert, mostly what you have to do is palpate and listen and observe. I really think that in a good treatment, 60% of the time that you're spending with your hands is assessing, listening, palpating, feeling. Because when you are in the right place on the patient's body at the right time, meaning their nervous system is ready for the input, and you stimulate the tissue or manipulate the tissue or stimulate the nervous system, I should say, in the right way, then it only takes a few minutes. Even a chronic issue will respond, not that it will clear and that the patient will be all better in a few minutes, but that you'll see changes. You'll feel changes under your hands. You'll observe the change in your patient. So anyway, I could see how neuromuscular therapy might have gotten short shrift in your education. It doesn't surprise me. It is sad, though. Anyway, Timothy says, the definition we were given was vague. When Googling it, I stayed curious about it. I had a suspicion it was something special as well as fascial work from the brief classes we've had about it. I'm glad that you felt that. I believe it's what you and Doug Nelson do, but how do you do it? How do I become a precise therapist? Besides anatomy, physiology, etc., what do I need to learn? I hope to address that in this and maybe some following videos as well. Maybe this will turn out to be a series. I don't know. So I have a lot of treatment demo, as you know, on my channel. And I try to explain what I'm doing. So maybe I can explain a little bit more when I don't have a patient right there with me and there's not a little bit of a time crunch. He says, Timothy continues, I've been using dry hands more often to loosen fascia, and my clients always tell me I'm the first one to do the things I do. Awesome. Yes, that's so cool. I love that. And I'm the newest at my business, so I think you're like the least experienced therapist at the spa adjacent. I come out and shake the client's hand. I ask questions about their life and write notes on paper during the intake. You're listening. You care. So much of what helps people relax is the feeling that the person who is about to work on them really cares about them and is going to be careful. I'm trying to be better than just good enough because these clients will tip $20 by default to the worst therapist because they don't know what a good massage should be. That's right. Our clients don't know. Well, some do, but some don't. They come in wanting to feel better. They're looking for a certain experience. There are some people who don't feel like anything happened if they're not sweating and crying during the massage. I am not one of those people. I go to spas. I'm looking for a massage, a simple massage. If I want something complicated, there's other people I could go to. But if I'm going to a spa, I want something simple and I don't want to be hurt. I always say, please be gentle. I'm sensitive. I don't like deep work because I think what I really want to say is, hey, my superficial fascia, like most people, is where I'm holding a lot of the tension. And if you could help me relax that, then most of my deeper structures will relax and I'll really feel a lot better. So I just say I'm sensitive and I prefer gentle work. And I've had massage therapists who've worked for me who have told me that they don't like doing gentle massage. They find it boring. And I don't really understand that at all. There's so much going on in the skin alone. And not to mention that just the superficial fascia, just those first two layers There's so much going on there. And I think where the elbow and knuckle crowd is going wrong is they're just going right through that and they're focusing on the muscle. We are layer cakes. We are onions. And you can't just go for the deeper layer. There's the misconception that the fascia is inert. It's just sort of like this fibrous tissue that's just sitting there. That cannot be further from the truth. It is richly innervated with pain fibers and mechanoreceptors. It's extremely strong. It has contractile properties, both short-term and long-term. And a lot of the times, the tension that a massage therapist feels in the erector spinae is not in the erector spinae, it's in the fascia overlying. The muscle's just bunched up in response to that. And so you lean on it with your elbows and the muscle doesn't give up. And so they think, well, I'm just going to lean harder. You got to go in the other direction. We charge too much for me to not provide better care. I totally agree with you. I want to deliver value to the people who are coming in, paying their hard-earned money to me to do my thing with them. I know I'm at the wrong business, and I'm working on finding a place that puts more emphasis on results rather than getting bodies in and out. But for now, I need your help with how this works. Okay, well, again, Timothy, I really appreciate hearing from you. And if you're watching this video as a massage therapist, physical therapist, chiropractor, body worker, and you're having the same questions, let's get into it. Let's talk about it. I want to talk a little bit about my own journey here because I would like to acknowledge, again, that I have received a lot of help and support and had a lot of good fortune over my life. But also, like, I didn't come out of the womb doing what I do. It took me a long time, like I said, about 10 years to maybe, I would say actually, maybe closer to 15, to really finally settle into something that both felt good to me physically, that feels good to me to provide on a heart level, that makes sense to me on an intellectual level, that people like, that works really well, and just kind of checks all the boxes. And then, of course, something that I feel like I can do sustainably. When I was probably in about year 3 or 4, and I realized, like, okay, this is going to be my career. I'm going to stick with this. For some reason, I got the number 35 years in my head. And that's kind of what I've been thinking about this whole time. Since then, for the last 20 something years in practice, like I want to make it to 35 years in practice. So that would put me at 66. And we'll see. We'll see if I have the good fortune to make it. I hope so. But my very first introduction to bodywork was as a massage therapist learning shiatsu. And I don't know why I picked shiatsu, but there was a school near my house and blah, blah, blah. It was in San Francisco, 1993. And I remember the first time I gave a shiatsu massage, I was panting and sweating within 2 minutes. I was working so hard. And I remember the instructor, a very kind fellow who pointed out, like, you're really working hard. And part of your learning, he identified very quickly for me, that part of my learning was going to have to be to relax and not work so hard. I am not going to lie. It took me a while to figure that out. So for massage school, I did shiatsu, just sort of like friends and family and the very occasional paid client while I worked in restaurants. And I really liked it and I wanted to do it for a career, but I wanted to learn more. So I went to chiro school and I went with this shiatsu background. So I had some experience touching people and I had already taken anatomy and a little bit of physiology. And of course I had the whole meridian system had been taught to me. So I already had a holistic I had a holistic point of view that acknowledged and encompassed and incorporated the chi and the energy in the body and the life force and that innate intelligence, that vitalizing spark that differentiates a dead body from a living person. And I didn't need to be taught that, and I didn't really need to accept the things that the chiropractors said about it, which didn't really jive with me. And so during school, I took a lot of classes in applied kinesiology and craniosacral therapy. And those two things were really important. Even though I don't practice AK anymore, it helped me understand how the muscular system works together and how the muscular system communicates through the nervous system with the deeper tissues of the body, the viscera, and with the brain and the mind and the emotional body itself. I learned a lot of really interesting techniques, most of which I don't use anymore, but which I did use for a while and worked really well, and got me a bit of a reputation as someone who can fix things. And I would never want to forget the things that I learned there, even though I don't use it anymore and I don't take their classes anymore, for reasons I'll talk about in another video. But suffice it to say, it just doesn't really fit with me intellectually anymore. And I don't like, well, I'll just say this. There seems to be, with AK and muscle testing in general, sometimes the feel of it from the provider is that they're using it to prove something. And that just, I don't like that. That doesn't feel good to me as a patient. And quite honestly and transparently, like, there were times that I found myself getting caught up in that. And I don't want to do that. The book Craniosacral Therapy by John Upledger was really instrumental in changing my point of view about palpation and what palpation is and what listening is when you're palpating. There's a chapter in that book about palpation skill that I recommend to everybody who wants to do body work. Even if you don't want to do craniosacral therapy, or you think craniosacral therapy itself is kind of whatever, check out that chapter. And I'm just going to say up front, I am receiving absolutely no promotional consideration for any of the books that I'm recommending here. These are just books that have influenced me. So Craniosacral Therapy by John Upledger. There's also the book, The Trigger Point Manual by Travell and Simons. It's kind of the classic original tome about trigger points. And I recommend that one as well, because trigger points exist and they're painful and they are irritating to the nervous system and the body. And you're going to feel them on basically 100.00% of the people that walk in your office will have either actively painful trigger points or latent trigger points, which are not actively hurting, but which are tender and irritable and which are affecting the function of the muscle that they're in, and therefore affecting the function of the synergists and antagonists. So when I was reading the craniosacral therapy book, I took to it and I liked it, and I started doing it with my wife, who is very sensitive and really likes light work and gentle work. So obviously, because she liked it, I did it more. I liked how it felt to me. I like the feeling of doing it in my body. It's slow, it takes time, but it's incredibly relaxing and incredibly effective if you're doing it correctly. So when I got out of chiropractic school, like most people, I wasn't very good at adjusting, the cracky part. I had my AK, so I could do the muscle work. I was always interested in the clinical reasoning, and which is really, really lacking in a lot of body work and PT and chiropractic education today. And I say this as an informed person who has taught at massage school and taught at chiropractic school and taught at naturopathic school. I've never taught at physical therapy school, so I don't know about their education, but I wouldn't be surprised if it wasn't that much different. And I always felt like clinical reasoning is kind of like, that's the whole Megillah right there. If you don't know what's wrong, then you can really only apply generic sorts of treatments. And that's okay. I had a mentor, Dr. Mary Balliet. Hi, Mary. Very long ago said, if you just did the general adjustment on everybody that walked in your door, presuming that there's no contraindications, 60% of the people would feel better. But if you want to do better than 60, you got to do more. And I definitely always wanted to do better than 60. Nobody bats 1,000, but 80, 85, 90. Yeah. I want an A in life. When I die and I'm talking to God, and I want him to be like, you got an A, you did it. You did it right more than 90% of the time. I'm only partly kidding about that. Anyway, so I was doing craniosacral therapy a lot in my first couple of years of practice, and people were coming for that. And it was good because, I didn't have that many patients. I didn't see that many in a day. So I had an hour or an hour and a half that I could schedule with people, which meant that I was spending more time with each person, so I didn't need as many people per day. And then I charged more, so I was able to start making a living. And then it was through that experience of a couple of years of focusing on that type of work, which worked for me and worked for my patients, that I developed the palpation skill where I could finally really start to feel the joint dysfunction and the articular fixations that require adjustment. And then once I had that better palpation skill and a better visual in my mind, I was able to really work on my adjusting skill and get that done better. And then there was another period of time where I was a knuckles and elbows guy. I would say this was probably from like '06 to '09, so the late 2000s. So we're talking like 10 to 12 years in practice. In my 10th to 12th years in practice, I came across some neuromuscular therapy material. And I had done NMT before with the trigger point work and origin insertion work and neuromuscular manipulation through AK. But this was very deep and aggressive work. And I was sort of taken by it. And I got results because you get in there and you move stuff around and it changes how people feel. And to this day, I have some patients that still see me who I first helped with some very deep neuromuscular work. Mobilization with movement is what I call it now. So as they're moving their body, I'm doing deep, deep stripping longitudinal massage, like elbows or knuckles. And there were some chronic problems that I was able to clear out in a couple of visits. I was really kind of amazed at it. My technique now, as you see on the videos, has definitely evolved. I will get deep, but I'll take my time getting in there. And in taking my time, I don't have to use my elbow or knuckle because I have access to the deeper tissues because I've taken my time and addressed the more superficial tissues first. So it was probably, now this is 2025, it was probably about 10, I think about 10 years ago that I really started to settle into a few things that have really served me. And I think probably is going to be the way that I continue to do this until I'm done, which is maybe 10 more years if I'm lucky. And I don't know, maybe not. We'll see. So of course, palpating and listening, knowing anatomy. We did a video recently with Ashley where she had some anterior hip pain on her right side. And I was able to identify, and I don't know if I was right or wrong, but it felt like there was a lot of restriction deep in the quad around the femoral nerve. Now, if I didn't know that the femoral nerve was there and what it did and where it innervates, then I would never have been able to understand that possibly her femoral nerve was entrapped under the inguinal ligament. And if I didn't know that the femoral nerve originates from L2, 3, and 4, then I wouldn't have known to check those segments for fixation or restriction or some mechanical problem. And then I wouldn't have found the fascial issue in her right QL that we were able to address. And so knowing your anatomy, origins, insertions of all your muscles, of course, if you have your hand on the anterior thigh, like, do you have a sense of what the layers are? Where's the rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis? Where are they going? Where are they coming from? And what else is in there? Your femoral nerve, your artery and vein. And now, of course, variety is the rule in anatomy. Everybody is different. That's obvious. You can just look at people and see we're all different. Our skeletons are pretty consistent. Our muscular system is a lot more variable than that. Our nervous system is a little bit variable, and our vascular lymphatic system is extremely variable from person to person. So when you put your hand on someone's anterior thigh, it's different person to person. You don't maybe know exactly what's what at first, but if you know where the muscles are and where they're going, and you know the layers, then you can use depth and fiber orientation to help you understand which muscle you're working with. So I'm going to say that again. It's the depth of the muscle and the orientation of its fibers that tells you what muscle you're working on. So if I'm on the anterior thigh and I'm on more of a superficial layer and the fibers are running longitudinally in the inferior superior direction, that's the rectus femoris most likely, right? The vastus lateralis is going to be running obliquely medial. The vastus medialis also running obliquely lateral. You get the point. And this is true all throughout the body. And the more detail you know these things, the more precise you're going to be able to be in your palpation and assessment. And if you're licensed to diagnose, your diagnosis, and therefore your choice of treatment. So understanding the difference between a restriction and trigger point that's in the superficial fascia, or it's in the deep fascia, or that's in the muscle is only relevant if you know where those things are and you know what they feel like. And the only way that you can do that is through study and practice. Anatomy is a language. It's terrain. Palpation is a language. It is a vocabulary of palpatory experience where you start to recognize grainy, boggy, soft, concrete. What's the difference between a muscle feel that when that muscle is hypertonic because the nervous system is in a hypervigilant state and the whole person is tight, versus a muscle or fascia that has a trigger point in it. Those two things feel different under your fingers. They show up different for the patient, and they require different types of things to address them. And the only way to do that is through study and practice. You are amassing a database of palpatory experience every time you feel someone. And every time you feel someone new, you're amassing more, but you're also comparing what you're feeling in that moment to everything you felt before. And this is happening automatically in your brain, which is insanely, incredibly beautiful. And so you just have to keep at it. You have to keep at it with the attitude that you have, that you want to be better, you want to learn. You don't want to just do the standard massage and get the $20 tip and then on to the next person. You want to understand this person as a whole person. You want them to know that you care. You want them to feel cared for. You want them to have that experience. Because I think deep in your heart, number one, you just like to be good at what you do, which I think is awesome. But also you realize the potential for this to help other humans. And we're all homies on this planet right now. We're doing this thing together. And it's a little bit fucked up right now. And the more we can help everyone feel a little bit better in their bodies and have a little bit of a better experience in this meat suit on this floating rock, the better time we're all going to have. And I don't know how to say it any better than that. Also, it's very nice to understand and appreciate about the nervous system and people's vigilance and arousal states when they're coming in for body work. If someone is on guard and cannot relax, then you have to help them. Working a trigger point in the upper trap of a very tense and tight person is going to hurt you. It might give them sort of a little bit of a temporary relief, but it's not really a therapeutic experience. Sometimes people come in and they have a certain pain and they want me to address their hip pain, let's say. But I notice when they lay down that their whole fascial system is hypertonic. It's all tight. It's that plywood sort of concrete back feeling. I could get out the oil and warm them up and steamroll them with my elbows and sort of force some softness into the tissues. But that's treating the person like a pizza dough when they're a whole system, and their body, their nervous system is making a choice in that moment. Not a conscious choice. They're not doing it to make my life hard. It's a choice to be vigilant and be guarded, and it has nothing to do with me. That's their life. But there's things that I can do to help that. Things like speaking softly, things like being welcoming, things like the first touch being a gentle touch. Things like just sort of the whole mood and atmosphere of your office. In chiropractic, there's sort of a pretty significant segment of the profession where offices are like lively and loud and bright and busy And that's great. And there are some people who want a pick me up and they want to go to the chiro and be like, look, I get in, I get out, I get my adjustment. It's my copay is $20, whatever. And that's awesome. That is not me. I don't want to work that way. I don't want to be that way. I don't want that to be my experience as the patient. My office right now is pretty spacious and light and bright, but it's quiet. It's just me and the patient. There's no one else there. I play soft music. I've got plants. Check in. Just asking the person, are you comfortable? How's that face cradle? Are you warm enough? Are you chilly? In the summertime, if it's hot, would you like me to turn up the AC? How's the music? Not harping on it. I don't have to ask all those questions all the time. But usually, because I really do care, and also I know it'll help the person relax, is I say, how's the music? Lighting okay? Are you warm enough? Great. Ready? Okay, good. And then I'll start with a gentle touch. And if I'm sensing that the person is particularly anxious or vigilant, I'll let them know explicitly by saying something like, anytime you need a break, you just let me know. You need something to shift. It's no problem. Just like that. It may seem crazy, but people really do respond to that. Speak to them softly and not inauthentically, but soothe, and then by doing so and also moving with as much confidence as you can muster, it will help them relax. And what they need to do is relax so they can receive. And sometimes people come in and they seem mellow until you touch them and then you realize they're actually really tense and tight. Don't be fooled by their personality. What their face says and what their voice says may not really be what their body is telling you. Some people hold their tension in their voice and face, but most of us don't put it there because we don't want everyone else to know. We're putting on a happy face and saying everything is fine, and then shunting all that tension into our breathing, our shoulders, pelvic floor, hips, low back, feet, hands, jaw. Use your hands and trust what you're feeling. When it comes to this idea of trusting what you're feeling, here's what I'm talking about. If you are pressing on a muscle and you're working it and it's not responding, maybe just move on. It's okay. It's okay to stop for a second. If you don't want to take your hands off the person, that's fine. You can just hold hands on and just do like some gentle skin and superficial level rubbing. Just take 10 or 20 or 30 seconds to reset for yourself, so that you're not getting frustrated and that you're not trying to force their body into doing something that you've decided it ought to do. Trust their body and trust your own self when you realize, like, okay, this isn't working. Also, I recommend that you observe the client for things like, well, certainly their breathing. When this is great. I like to do this stretch on the upper extremity where I am holding fingers in one hand and I've got the other hand on the lateral border of the scapula, and I'm just giving like a gentle traction of the arm. Feels really good. People holding a lot of tension in their wrists and forearms these days with all the phone use. And a lot of times as I'm doing that, I'll just watch the person go like that. They're breathing into the stretch. That's a sign that they like that. They want more. They don't necessarily want me to just keep doing that the whole time, but they want more of that. Observe their breathing. If they're like, some people lay down literally like this with their hands tucked up against them, that's not a relaxed person. And so, not to berate them for that, it's not their fault. It's your job to help them relax by, are you comfortable? Anything need to shift? Are you cold? How's the music? Everything good? Okay. How about we just take this leg and just jiggle and jiggle and just sort of help. You'll see me do a lot of rocking of patients as I'm working on them. It's something I just started doing, 10 or 15 years ago, and I got some feedback like, oh man, that is really, really soothing. That's deeply ingrained in our nervous system. So looking for things that help them, closing their eyes. And sometimes you can just feel the energy shift. I don't know how else to describe it. You just see that they are relaxing, and that's what we want. Okay, I've talked for about 40 minutes now. I have a lot more to say, but that'll probably do it for this video. But I'm realizing now more to come because I have more of an email exchange with Timothy. I emailed him, he emailed me back, and so we'll address part 2 in the next one. Okay, for now, thank you for watching. This is Dr. Russ.